Hello again, everyone. This is Dr. Sistare with Palm Beach Cosmetic Surgery. Thank you again for tuning into another one of my videos. Today we're going to talk about arm lift. So, as someone goes through life, they tend to gain weight, lose weight, changes happen. One of the changes that some people notice is the skin on your arm becomes more relaxed. They might notice it when they put their arms over their head. The skin down here on your as your bicep turns into your tricep, it becomes looser. And for some people, it's more noticeable than others. Depending on the severity to which it is relaxed, there's a few different things we can do to achieve that tight skin that you used to have when you were younger. What choice we make when it comes to either surgery or liposuction really depends on why you're having that excess tissue. If you have a lot of excess body fat, some people tend to put on their body fat in their upper arms, and consequently that fat sags down and moves a little bit when you move your arm. If your issue is excess body fat on the arms, arm liposuction is a perfectly reasonable avenue to pursue. You make a small incision. Normally it's right in front of the bone on your elbow, right here on the inside of your arm. And using a cannula, we can pass the cannula up and down the inside aspect and the back of your arm to remove the excess fat. Slowly, over the next few weeks to months following your liposuction procedure, the skin tends to contract down and becomes much less loose. If you have too much fat for us to think liposuction is a reasonable modality to pursue for you, then skin excision is the other option. So the skin excision, we tried to hide the incision along the natural boundary that exists between your bicep and your tricep, so that if your arms are hanging down at your side, whether someone's standing in front of you or behind you, they can't see that incision unless you physically lift your arms up like this. So that procedure starts with liposuction to clear out any excess fat in front of your muscle underneath your skin. And then once we remove that excess fat, we can then make measurements to figure out exactly what is the appropriate amount of skin to remove. Over the weeks to months following that skin incision, the skin that remains tends to contract down and get nice and tight. And the end result of all of that is a tight, more youthful looking upper arm that doesn't have the relaxed skin that it had before surgery. So, like all other surgeries, there come a set of potential risks with arm lift. Sometimes there's accumulation of fluid under the skin, whether that fluid be protein, water that your body secretes, or blood. Most of the time, that fluid that accumulates tends to go away on its own. We don't need to do anything in particular. It'll just get reabsorbed by the body. If it gets to the point where the fluid is stretching out the skin again, it's as simple as sticking in a needle and sucking out the extra tissue, sucking out the extra fluid. One aspect of the recovery of this procedure that's different from the recovery of any other procedures is during the process of removing the fat and skin of the upper arm, the channels that drain fluid from your hand and your forearm back to your body are disrupted. So we're going to ask you to wear compression garments all the way out to your wrist for the few weeks following surgery. And I'm going to warn you right now, your hands are going to get a little bit swollen, and that's perfectly normal. Your body reestablishes those drainage channels, but it takes a few weeks for them to get back to normal. A few different things you can do to minimize the swelling that you will encounter after surgery is, one, the compression garments that I mentioned, and two, when you're sitting, resting at home, you try to keep your arms on pillows elevated above the level of your heart. That allows the fluid to naturally drain back into your chest, and it decreases any swelling that would accumulate throughout the day. It gets better and better as time goes on, and it'll eventually get to the point where the swelling that you saw after surgery doesn't exist anymore, and you're back to normal, and your hands are not swollen at all. So that's a unique consideration following this particular type of surgery, and it's nothing to be worried about. It's expected, I can tell you. So, in a nutshell, that's what an arm lift is. I thank you for watching my video. Once again, I'm Dr. Sistare. The practice is Palm Beach Cosmetic Surgery. I invite you to make an appointment for a consult with us. Consults are free. I can sit down and talk to you more about this procedure or any procedure that you have questions about. I'd love to discuss your goals and figure out exactly how I can help you achieve your cosmetics goals. Thank you so much.